Hello, my name is Monique Miller, and I am a mental health therapist, a child and family therapist with Central Minnesota Mental Health Center. I'm a licensed psychologist at the master's level, and I am providing mental health consultation services for Head Start for about the past 6 years now. Head Start has asked me to talk with you a little bit about how we define early childhood mental health. I like to use the 0 to 3 organization's definition because I find it very helpful in understanding just what we're talking about when we are looking at early childhood mental health. It's a pretty simple definition. It's the capacity for children to experience, express, and regulate emotion. We are looking at their capacity to form secure relationships and from there go out into the world and into their environments to explore and learn. So, this is the definition we use when we're trying to determine, do children show some signs that perhaps they're struggling with their mental health? So, when we see difficulty with emotion, with relationships and using adults for comfort and support, and when we see difficulty with exploring and learning, that's going to bring us to wonder about children's mental health. Perhaps you've wondered about your own child's mental health. Today, I want to tell you what is going to take place if you were to ever decide to seek some help for your young child's mental health. At times, there may be recommendations from schools or other health professionals that perhaps you should seek some mental health evaluation or assessment. I thought it would be helpful to know that when you seek a provider that does this service, like a child and family therapist trained in early childhood, as I am, you are going to meet someone who is very thoughtful about your comfort and the comfort of your child. I wanted to show you some things that are in my office. I have so many toys, and I really want your child to feel comfortable when they come to my environment. An early childhood assessment is very different. We don't just sit in an interview form with a very young child. It's actually a 3-part process. We will first interview the parent or caregiver, and we will talk about that child's history to date. What have they been through? What can they do? What are they like? As well as any traumatic or life experiences that you think are important for us to know. And we do that without boring the child and without exposing them to a bunch of adult information that perhaps they don't need to be hearing. So the second part of the assessment is that we like to observe these children in an environment of learning. So if they are in preschool, or perhaps they are out of the home in some type of daycare, childcare experience, we will go and observe them for about 45 minutes in that environment, just getting a sense of how do the adults interact with the child and how does the child respond in that environment. The third part of our assessment would be to have the caregiver and child come to our office where we can observe them and get to know them. So once these 3 parts are completed, we will also write up a report. This report does have a mental health diagnosis typically as a result. This is frightening for some families and parents, but I want you to know that this mental health diagnosis remains with the file and between you as the caregiver and myself as the provider. I cannot tell that information to anyone else unless you provide a signature that allows me to do that. The other thing about diagnosis is that it's very important for payment purposes and to get services. And children's diagnoses can change and they can resolve. So these aren't labels that have to stick with children forever. So I want you to feel comfortable talking to your provider, whether it be me or someone like me, about how you feel about diagnosis and get a full understanding about how that information will be used. You have a right to that, and it is protected information. So once we complete the assessment, we'll provide recommendations. Recommendations may include therapy, and therapy often is with toys. And in early childhood, it does involve the parent and the child together. So this should be a part of intervention with the 0 to 5 age group. I hope this information has been helpful to you, perhaps reassuring, and just so you know what to expect. We also are very happy to answer any questions. And so as you begin this assessment journey, you're going to meet first with the provider without the child present. And you may decide you don't want to continue, and that's okay too. So I hope this has been informative, and I look forward to speaking with you again about other topics. Thank you.